your health is your wealth. And what we realize today is that technology can enable vast improvements in the way that healthcare is delivered, access to healthcare, the quality of the care that you're receiving, as well as the affordability of that care. If infants who are HIV positive are not started on treatment as soon as possible, there's a 50% chance that that infant will not see his or her second birthday.
Early infant diagnosis of HIV is a diagnostic test available only to infants under 18 months, where traditional diagnostic tests for HIV can't work. However, it's a fairly complex test.
We use sophisticated technology that looks at the DNA of HIV. Those technologies are fairly difficult to access.
Because of that process and the technology involved, it takes longer to get the results.
It was unpredictable how soon the test result would be back. Now, with the advent of technology, that problem was solved.
Jackson is our partner in crime.
Partnering with a global leader in health, such as Clinton Health Access Initiative, we bring answers and solutions that help the Ministry of Health and ultimately help those infants and their families.
HP provided the hardware, including the data centers.
And we worked with local institutions, specifically Strathmore University. We gave opportunity to students. They spent 3 months designing an application that collected test results from the analyzers and put the test data back into a database that sat in the infrastructure built by HP at each lab.
Before we used to come up with hypothetical problems for them to solve. Now they are solving real-life problems. We have narrowed the gap of the academia industry in trying to help students gain and hone skills that will help them be useful after school.
The early infant diagnosis program has really helped me. I've met people, I've had the experience of programming, I've learned SMS and mobile web, and I'm sure I'm going to use this after graduating in 2012.
This project is saving lives, and it can be a great achievement in Kenya.
I'm a mother living with HIV/AIDS. I knew my status back 1998. I was expecting a baby. The baby was infected and the baby passed on.
Mothers to Mothers is an international non-governmental organization. We work currently in 8 African countries and are headquartered in South Africa. We hire, train, and employ HIV-positive mothers from local communities to provide peer-based education and psychosocial support to their colleagues.
Mothers to Mothers has given me the opportunity to help other mothers who test positive. I am here to empathize with them and be with them all through the journey.
Everyone at Mothers to Mothers is very excited about the partnership between HP and our organization. We're moving towards a system of online data use where information can be much more readily available and accessible and inputted through electronic methods.
What we have demonstrated with this technology is that with centralized data centers, we could easily deploy a solution that would be available at scale in an entire country. No one else has invested in technology of this magnitude. It is definitely changing the way public health is delivered in Kenya and potentially in many other countries.